So after my assessment in your mouth, I have a few things I would like to talk to you about regarding your gum health. This will help you to better understand what is going on in your mouth and to make a decision about how you want to treat it. Do you know what gum disease is?
No,
Have you ever been told you have gum disease?
I have not.
Hopefully, after my explanation, you will understand what it is.
Yes.
So, Brian, throughout your mouth, you have moderate generalized tartar and heavy plaque throughout your mouth. So, do you know what calculus is?
Probably not as well as I should. Isn't
So,
that a buildup?
yes, it is buildup. It starts out as plaque, so when your teeth feel gritty, that eventually crystallizes into calculus, and it's really hard to get off.
You.
So, and those are your local risk factors that you can change yourself. This could be due to your lack of home care, or sometimes medications you're taking can make your body accumulate plaque a lot more. That is why home care is very important. Plaque and tartar contribute to gum disease, and we call it periodontitis.
Mm.
So the medications you're taking can contribute to the condition of your mouth, and being overweight or your diet can help speed up periodontitis. So these are your systemic factors. If your gum disease continues to get worse, you might want to think about changing medications or going on a different diet. And since your blood pressure is still high, I would recommend you make an appointment with your family physician to get on a different blood pressure medication.
Yes.
So, Brian, I'm going to explain to you about what is going on in your mouth.
I don't want to know.
Well, I'm gonna tell you about it.
Okay.
Okay, so this is a healthy mouth and gums. So as you can see, the probe we use to measure gum disease, 1 to 3 is health, and then 4 is gingivitis, and 5 and above is considered perio.
That's not good.
So it's measured in millimeters. So as you can see, the probe is at about 2 millimeters, which is considered a healthy mouth. And you can see that the gums are nice and pink, and the bone is still intact, and then these ligaments help hold in the tooth.
Nice.
So this is what a healthy mouth looks like. So gingivitis. As you can see, the gums are a little inflamed, and the probe is at about 4. So that's a warning sign that you want to act now before it turns into periodontitis.
It's no bueno.
And as you can see, the bone is still intact, and so are the ligaments. It's just inflamed.
Am I at that stage, or is it worse?
Unfortunately, it's worse.
Oh.
So this is early periodontitis. So as you can see, the probe is at about 5 or 6 millimeters.
Ouch.
And there is starting to be a little bone loss.
Ooh.
And these fibers that help anchor in the tooth are starting to deteriorate.
So my tooth could fall out?
Eventually, yes, it can.
Oh.
So you can see there's starting to be a buildup of calculus on the root surface. And then as you can see, the gingiva is inflamed and it's red.
Ouch.
Yeah.
This isn't good.
No, it's not good.
I need to do something.
Oof. So you were at about the moderate stage in most of your mouth.
Yes.
So this is what's going on in your mouth. As you can see, the probe is at about 6 millimeters. And, the bone is getting pretty low now. And these fibers are really starting to deteriorate.
I need my fibers.
And you can start to see that there's starting to be exposed root surfaces, which is not good because you can start to get root cavities.
Oh, that doesn't sound good.
So you're starting to get some recession, as we call it, an attachment loss.
Oh, that does not.
So then you do have some advanced periodontitis in your mouth, especially your lower front teeth. So as you can see, there a lot of the root is being exposed, and the probe is at about 7 or 8 millimeters now. And you can really see that the bone is really getting down there.
Yeah.
And a lot of calculus buildup is happening.
Looks like something is missing right there.
Yeah, the bone and the
right there.
The bone and the PDL fibers are gone, and there's really no way to get it back.
So I'm screwed.
No, you're not.
There's hope?
Yes, there is. So I'll tell you about my treatment plan for you, and we can go from there. But I just wanted to let you know that you have moderate periodontitis and advanced in some places.
That's not good.
So
my friend Billy lost a lot of his teeth to it.
Well, let's not be like Billy and make some changes.
I don't want to be like Billy.
So the treatment I recommend is called scaling and root planing. So this involves removing the tartar, or the buildup, from your root and the crowns of the tooth. This treatment will reduce probing depths, which is good because you had a lot of 7s and 6s.
Ouch.
And it will reduce bleeding and inflammation, and it will help with your bad breath.
I do a very bad breath.
After that, you will come back in 4 to 6 weeks, and we will do a tissue check to see how your mouth is healing. So then after scaling and root planing, you will be on perio maintenance for the rest of your life at 3-month intervals to start. So periodontitis cannot be cured and can only be maintained, which is why you will have to come in every 3 months now.
What happens if it gets worse?
If it gets worse, we will have to alter your treatment plan, and you may have to come in 2 months sometimes.
Oh, no.
But depending on how your body reacts, you could have to come in 4 months. So it kind of depends how your mouth reacts.
I hope my body is good.
So here is a pamphlet I have for you on scaling and root planing. So this will... You can take that home and read up on it.
If only my teeth looked like his.
So...
Interesting. Did you make this?
It's at the office here.
Oh, very nice.
So after we are done with scaling and root planing, I recommend you get a fluoride varnish because you have exposed root surfaces and furcations.
Will that protect the root surfaces?
It will help prevent cavities.
Oh.
Do you know what a furcation is?
No, I do not.
So are you aware that the molars have 2 or 3 roots?
Yes.
Okay, well, what happens when your gums recede, it starts to expose these root surfaces, and the furcation, like, let's pretend this is a root, it starts to go down, and you start to see the V shape of the root.
I don't want to see that.
Well, we're going to help you to prevent it from going down any further.
Help me.
You also have previous fillings, which means you're already prone to cavities. So that's why I would recommend a fluoride varnish.
Yes, I have many fillings.
So the number of appointments this scaling and root planing will take is probably 3 or 4 appointments, and the appointments are 3 hours long.
I'm going to be seeing you a lot more, aren't I?
Yes.
Oh.
So I know this is a lot and takes a long time, but it is necessary for me to remove all the buildup on your teeth. So the mouth is split into 4 quadrants, and we will probably get through 1 quad an appointment.
Could I die?
No.
Okay.
So since you have a lot of buildup and exposed roots, your mouth will be very sensitive while I'm scaling and root planing. It is a good idea to numb you up during your cleaning. So this will allow me to do a good job and not be concerned about you being uncomfortable. So do you think that's a good idea to use local anesthesia?
Yes, I would very much like that.
Okay. So as I said before, you'll have to come back in 4 to 6 weeks for a tissue check to see if the tissues are healing and if you need any further treatment. I also recommend an antibiotic therapy called Arrestin. So we will put this in any pocket above 5 millimeters. Arrestin will help kill bacteria in your gums, and instrumentation alone cannot kill it, so me using my instruments. After I place Arrestin, you should not floss or use toothpicks for 10 days after, so Arrestin can do its work. Also, avoid hard, crunchy, or sticky foods. Arrestin is free here at the MSU clinic. So I have another pamphlet for you on Arrestin.
Oh, he just.
So this procedure will cost you about $70. It is more than a regular cleaning because it takes longer.
I'm gonna have to sell one of my kids.
And we are working on the root surface.
Yes.
So your prognosis is good if you keep up on your maintenance appointments and have good home care.
Yes.
So I will refer you to a periodontist to see if there is any surgery to help you in your treatment, like a gingival graft or a bone graft can be beneficial in helping to rebuild bone.
Yes, that sounds painful.
So then after the scaling and replaning, you will be on perio maintenance appointments at 3-month recalls. This is necessary so the disease does not progress and become worse. Depending on your body's reaction to the treatment, we might be able to put you on 4-month recall appointments eventually. So here is a pamphlet on perio maintenance that you can read up on when you go home as well.
I have lots of reading to do.
Yes. So to help you with your home care, I'm going to give you an end tough brush to help you reach those furcations in your back molars. And I'm also going to give you a proxy brush so you can clean in between your teeth.
Mm-hmm.
I'm also going to have the dentist prescribe you a prescription fluoride toothpaste since you have exposed root surfaces. So, Brian, how are you feeling about this treatment plan?
I'm feeling good.
You're feeling good? Do you agree to this treatment plan?
Yes.
Okay, that's great. So, Brian, we will schedule your next appointment and we'll start the perio therapy.